Hello,
is
Dr. Friends.
Please like, subscribe, and comment. And our Halp fans are gaming.
Thanks a lot. Really helped us.
With such passionate interest, we'll respond by bringing the next doll series soon.
Which doll?
Which doll?
A sheep.
It feels kind of stiff and rigid.
Instead,
Looks bad too.
I'll choose the sheep.
I'll do it in English. As Halp fans wish, we'll hear the professor's advice.
Minimal patient info.
Now abandoned in a kindergarten.
Then anonymously abandoned.
Shows aggressive behavior and believes he's a wolf. They say.
At the end, it went woo.
Oh, really?
And shape.
Seems to be due to inferiority complex. Saying this. Hallucinations come and go. The wolf and sheep idea.
Ironic mix.
Let's do a basic medical examination. It's similar back then too. On the head like this.
Stethoscope on the head. It's just a doll.
Toes or stomach, same.
Growling.
Growling at first. Wondering what's inside it.
Expressing aggression.
Exactly needs psychiatric consultation.
I doubt a sheep's vocal cords are made to make that sound.
It's a doll. Let's do a detailed doll interview. Doesn't
It's a
actually
doll.
do this sock used.
Oh, you can't do that! Seems like it's trying to look similar. Oh, it kind of communicates her.
It jumped.
Seems calm.
Wagging its tail. To sheep. Like a dog.
Right? It does seem a bit like a dog, doesn't it?
Like a
Compared to
canine.
the crocodile, it looks stable. Dreams are key in games. Let's analyze dreams.
Start with hypnosis.
Let's delve into the subconscious to see if there's any hint. Still uncertain if it sees itself as a wolf, but no aggressive behavior has been shown yet.
Apart from that earlier, how there's nothing else?
What feeling?
The pupil.
What is it?
What?
The sun.
It's the sun.
In the desert.
Sun black.
Strange.
Looks like night. The moon.
Osis. Tough desert.
Running like a dog. Sheep don't do that, right?
Never seen sheep run.
Maybe it did.
Animal.
Like a hippo covering its mouth.
A hippo?
Toy. Tag scene.
There's a tag.
A toy like a hippo with its mouth covered is going in.
Following it.
Doesn't seem very scary. Oh.
What is this?
I'm really scared. Stomach opening. It is.
No big hint yet, but it's a bit better. That red thing looked like a tongue.
A long tongue.
It got startled. Seemed like something was coming out, but itself harmed.
Oh, self-harming.
Oh, self-harming.
Preventing self-harm is a priority. It's very dangerous.
Medication.
Give medication?
While observing the unconscious, it's somewhat terrifying.
It could have been hard, bad memories. It gives it to the nose.
Their eyes widen like a crocodile.
What's happening?
The medicine doesn't inflate people. It breaks defenses, reveals unconscious, and now a wolf appears.
Oh, worse now?
There's a wolf inside. I'll do more interviews. Can't diagnose yet, but they're self-harming again.
That situation looks really bad.
Showing a mirror.
Showing not a wolf.
That could be it. Facing it.
You're a sheep.
Oh, denial.
That's severe.
Severe aggression and self-harming, but it's a doll, so no real harm.
That's relief. No blood, but stuffing might come out. We should stitch.
It'll heal itself.
Nano stuffing, huh?
Nano stuffing. Aggressive.
Delusional.
It seems like there's some self-harm, and from here, the motivation training with that crocodile back then, I don't think we need that now, and I'm not sure about occupational therapy in this situation. They talk about coping skills to reduce aggressive behavior, which can be helpful. But we should first find the cause of the aggression. We would need to analyze dreams to find the cause, but maybe in this game, through paint therapy, we can reveal this kid's unconsciousness.
We should examine the unconscious before taking any action.
Right? Knowing the cause, and while this game is a bit different from actual treatment, it seems to emphasize finding the cause of the struggle, and they're good at drawing.
They draw amazingly, even while pondering.
Eyes changing.
Aggression's back.
Becoming a wolf.
Look, it's rough now.
This drawing really rough.
Sheep again.
Why happened?
Oh, why this?
Self-harm aggression.
This is tough.
Really not good.
It's gotten a bit better, but I still don't know. I'll do another interview because it's still unclear.
Continuously self-harming and seems very unstable and confused, and inside the wolf keeps trying to come out. See in mirror.
Awake earlier.
Own face.
Ears are long.
Oh, I see
I
a
see a
wolf there.
wolf. Surprised.
Not a wolf, right? They
Right.
see themselves as a wolf, and it keeps trying to come out from inside.
If we really dig into it, like I've mentioned a few times, it might be about identity disorders or something like that, commonly referred to.
They are sheep, but have a wolf-like personality inside. As we saw in Dorothy, the reason they have this wolf personality could be linked to some trauma or past injury. Sheep are known to be gentle.
That's right.
But due
That's
to
right.
such trauma, a new personality or self, like a wolf, which is aggressive and protective, might have split off and been born. Identity disorder is not very common, and most psychiatrists might count the cases they see on one hand. It means the patient is confused and their sense of self is collapsed. So they use a defense mechanism called dissociation. This explains why there's occupational therapy. It's interesting because one of the treatments for identity disorder,
Right? It's called OT.
Oh,
In
really?
textbooks, but it's only when you look closely. For dissociative identity disorder, art, therapy, and occupational therapy can help. Art therapy helps normalize difficult thoughts, emotions, and conflicts that are hard to express verbally through body sensations and images in art therapy. Occupational therapy helps with identity disorder where personalities fluctuate
That makes sense.
through well-structured tasks that require focus.
it is said that symptoms can be managed.
To focus elsewhere.
Right? Yes. Because in psychiatry, it's called depersonalization. Patients with identity disorders often feel like their body isn't theirs, and they're observing themselves as a third party. Occupational therapy helps normalize these body sensations, which can be beneficial. Since we tried paint therapy earlier, maybe we can try some occupational therapy.
I'm not really energetic now.
Is this knitting?
It's knitting, something to focus on.
Cute.
It is cute.
Oh, you're doing well.
What you make could be meaningful.
What you make? A tongue?
A tongue?
A caterpillar?
Caterpillar. Or maybe a sock.
A sock. Thought it was a tongue.
Oh,
Oh, a muzzle like the dog's.
Well,
The hippo's
friend.
Yes.
does this have meaning?
To stop talking. To keep the tongue in because it was scary.
We should analyze the dream about the hippo wearing it. Let's try since we can now.
Seems frustrating.
I put it on myself, didn't I?
From earlier. It's wearing it now. Oh, tongue!
Oh, tongue.
Yo-yo.
Tongue's a yo-yo. It feels like he's teasing himself, right? Spinning around and teasing, almost mocking. So the fact that the tongue changed like that means the friend thought of the tongue as such, right?
That friend a web.
Like a thread.
What is it? A spider web. It doesn't seem like a good feeling, right?
Back in forest. What's this? Dog bones? Woke up.
Shocked by the bones, right?
Yeah, oh, he seems scared again, doesn't he?
He's shaking, dreaming, a wolf. What? Oh. 2 personalities appeared. Progress dropped. In identity disorder, 2 personalities can appear.
That's really severe.
It's confusing. I think we should give medication.
Something calming.
Exactly.
Seeing the unconscious. It's chaotic now.
Can't give medicine.
Who to?
Moves a lot.
Wolves or sheeps?
To the nose.
The wolf actually looks calm, right? Oh, the wolf is sleeping. Should we try? It's staying still.
Sleeping too.
In the end, since they are essentially one, let's try again. The nurse put it in. In such confusing cases, calming them is necessary. Hopefully, the wolf stays in.
By pressing like this, you're preventing it from coming out.
That could be it. Now we know the cause, so we need to try occupational therapy or paint therapy. But motivation or these 2 aren't the problem. In cases like aggression, for example management, we teach cupping strategy. It's quite confusing.
Not that.
Since it's such a situation, let's try occupational therapy. We used a muzzle earlier, so we'll see if there's any change after the dream.
What? Oh, doing what we made earlier. Just like before.
Seems unnecessary since it's already made. But progress increased, right?
Dream analysis is back.
So shall we try?
We need to know what the traumatic event was, right?
Dream analysis is key.
Ultimately, the dream analysis reveals the inner self. Dream analysis reveals all.
Finding the cause and the ego.
A wolf.
Looks like it's saying, come here. Right?
Is this not a real wolf?
From the stomach.
Huh? It's a bone? Ah, so this bone.
Did you actually put the bone here? Maybe?
Becomes a zipper.
We probably shouldn't follow that. It's like a whole flower field. With the wolf.
Playing together.
Were they close?
Unconscious.
Like paradise.
Throwing the muzzle away, like discarding it.
Water dripping.
That tongue.
The dog licked it earlier, didn't it? It was quite unexpected, wasn't it? Ah, toy for the dog to fetch.
If they do well, you give a bone.
Ah, surprised by the bone.
When they come back, you say good job and give them a bone. So maybe the dog was surprised by the bone. The muzzle you made is for the dog.
Put it on. He wanted to put it on him. Even though he's a doll, he was used like a dog's toy. So that tongue must have felt like a mocking yo-yo to him. Anyway, he must have had a lot of anger and aggression. And he wanted to put a muzzle on the dog, but couldn't because he was just a doll. So, this immense aggression and anger were directed at the dog, but eventually, he created a new persona, a wolf, within himself due to that trauma. He thought of himself as a wolf and accepted the thing that feared himself. The muzzle he wanted to put on the dog, he put on himself.
On myself.
Because he thought he was a wolf. The aggression towards the dog ultimately gets directed at himself too.
So self-harm too.
Yes, self-harm is possible. As we talk in psychiatry, anger and aggression aren't directed at only one person. If you hate and are angry at someone, it's not selectively like hate Najun, only hate Chandyun. That anger and aggression eventually get directed at oneself too. Oh, isn't the name Dolly, like the clone Dolly?
That... Right.
In a way, it's unfortunate. He's having a hard time, so when he looks in the mirror, he sees a wolf and ends up attacking that wolf.
Because he hated it so much.
It feels like he's internalizing the hated object, but he's gotten much better just from a dream. Maybe we should try paint therapy. Textbook-wise, expressive occupational therapy is said to help. Earlier, we did it like this.
Earlier, he wrecked it. He must have drawn the wolf earlier.
Maybe he did. Oh, so he tore it.
Now as things change, he draws himself. Maybe the muzzle keeps the wolf hidden.
It might be a device to block his own aggression, which makes him less anxious.
Oh, boom.
He seems to fully perceive himself as a wolf. The trigger stimulus is like a kind of exposure therapy where he's facing anxiety-inducing situations.
Bringing the wolf.
It might be a dog. Oh, that's possible. Should we try it?
Now he's really stable.
Gives a bone. He was scared of the bone before, right?
But now, with paint therapy, he's comfortable enough to draw a bone. The wolf came out.
Tore out. Likes bones.
He likes bones, and earlier, when the wolf showed up, he was anxious. The wolf took over his personality. Oh?
Oh. Back to sheep, then wolf.
Might they merge into one? But the wolf personality isn't anxious.
Huh.
The tongue came out. Then suddenly, the wolf appeared.
Did he really manage to overcome it? I'm curious if that's what happened.
Seems so.
The wolf is brave.
When the dog comes, it's over, huh?
Oh, it's fixed. The wolf protecting himself was still him.
It was him, and he finally put a muzzle on the dog. In some way, he has the courage to handle and defend against such a dog within him. I mean, we all have anger and aggression sometimes, right? But a sheep is gentle, and when we say someone is like a sheep, it implies they're docile. He couldn't acknowledge the aggression or anger within himself.
Aggression when it might be troubling. This denial led to a split in a new personality. Robert neutralized both sides of Providence. He is not just a good person, he also has a wolf-like side. Sometimes he's kind, and by recognizing this duality, maybe his identity has been integrated. In the end, that's what I think happened.
You've successfully treated 2 people now. It took longer than before. It wasn't good, the condition was tough. The ego split.
Identity disorder seems to be a common theme in many games and movies.
Unique.
Seeing it here too, it seems like an interesting story. I don't have a dog now, but if I did...
Don't let it bite toys.
I should throw a ball. That's what I thought.
I guess that's what I should do. Thanks to help.
I think you'll enjoy this video too, so we'll prepare the next doll series. Thank you.
Thank you.